One is to inform you that we have a Twitter handle, Dr. Patrick Amoth, hashtag #AskTheDG, and we engage with the media, the public, every Wednesday from 11 to noon. So tomorrow is a chance for you to be able to bring all your questions on board, and our technical team will be able to respond, apart from any other question that you may ask outside that scenario. Then in terms of the COVID deaths and blood clotting, yes, COVID-19 is a new disease and presents with a multiplicity of syndromes, some which we only came to know about as early as just last week in children who are between the age of 5 to 15 years, presenting with severe respiratory symptoms and also fever, bleeding, and diarrhea, a syndrome that mimics a disease called Kawasaki syndrome. So indeed, yes, a number of patients are presented with what in medical terminology we call bleeding diastasis. Either they tend to bleed more or their blood tends to clot more. So these are some of the new presentations which we call protean that you are seeing with this disease. For now, we cannot be able to pinpoint that this is a presentation in Kenya, and for medical doctors to be able to address this, some people have started using even blood thinning agents to stop the blood clots. So most of these are still on a trial basis. Regarding the easily cases raised by my brothers Leto, of course, we welcome public-private partnership. And in Waziri's slide, you saw the slide which indicates that we have 20 labs that are now conducting the tests. Out of these 20 laboratories, 17 are public health institutions, and 3 are private facilities. That is Aga Khan Hospital, the Lancet Laboratory, and Nairobi Hospital Laboratory. These are validated and accredited laboratories that we have verified, and we are sure of their testing results. Regarding the cases that came from Eastleigh, indeed those cases, usually all the laboratories, once they have done the results, we have a template and a reporting system. All this information comes to the National Influenza Center under the National Public Health Laboratories. We collate all this information, and these cases actually appear in our line list, and contact tracing has commenced appropriately. So be assured that Lancet submits the information, and in fact, if you look at the slide Waziri presented, they have tested more than 4,800 cases, and all those cases are in our database. There was another question regarding the testing, again by Angela in Eastleigh. Yes, as we go for this targeted testing, the numbers will increase, and therefore we'll be able to pick more cases. This will be able to guide us forward in terms of the measures that we need to put in place, and also, of course, the pattern of the disease at the community level. And that will determine the interventions that we undertake going forward. Thank you.